Let's learn about Flublok influenza vaccine. Flublok is a vaccine indicated for active immunization for the prevention of disease caused by influenza A virus subtypes and influenza type B virus represented by antigens contained in the vaccine. Flublok is approved for use in individuals 9 years of age and older. Important safety information: do not administer Flublok to anyone with a history of severe allergic reactions, for example anaphylaxis, to any component of the vaccine. Please listen for additional important safety information throughout this video. Flublok is one of the 3 flu vaccines preferentially recommended by the ACIP for patients 65 and older. Flublok differs from cell and egg-based flu vaccines in that it is manufactured using recombinant technology. This ensures that the viruses represented in Flublok are an identical antigenic match to the FDA-selected flu strains and avoids mutations during production and their possible adverse impact on efficacy. Flublok is considered a higher-dose flu vaccine because it contains 3 times the hemagglutinin antigen content of standard-dose flu vaccines. Influenza hemagglutinin, HA, is the principal viral surface protein that induces protective immunity to influenza infection. A Phase 3 to 4 randomized, controlled clinical trial of about 9,000 adults, 50 years of age and older was conducted during the 2014 to 2015 flu season. The trial looked at the relative vaccine efficacy of Flublok quadrivalent versus a standard-dose vaccine comparator Fluarix quadrivalent. The trial evaluated vaccine efficacy against influenza due to any PCR-confirmed circulating strains. The trial showed that Flublok prevented 30% more cases of influenza than a standard-dose influenza vaccine. Flublok was shown to have a comparable safety profile to a standard-dose quadrivalent inactivated influenza vaccine in adults aged 50+. The safety of Flublok is established in individuals 9 years of age and older. The safety profile of Flublok is supported by one of the largest safety studies of a flu vaccine in pregnant women, with almost 15,000 patients. Additional important safety information: appropriate medical treatment must be immediately available to manage potential anaphylactic reactions following administration of Flublok. If Guillain-Barré syndrome has occurred within 6 weeks of receipt of a prior influenza vaccine, the decision to give Flublok should be based on careful consideration of the potential benefits and risks. If Flublok is administered to immunocompromised persons, including those receiving immunosuppressive therapy, the immune response may be diminished. Vaccination with Flublok may not protect all recipients. Syncope, fainting has been reported following vaccination with Flublok. Procedures should be in place to avoid injury from fainting. In children 9 through 17 years of age who received Flublok quadrivalent, the most common solicited injection site adverse reaction was pain. The most common solicited systemic adverse reactions were myalgia, headache, and malaise. In adults 18 through 64 years of age who received Flublok, the most common injection site adverse reaction was pain. The most common solicited systemic adverse reactions were headache, fatigue, and myalgia. In adults 65 years of age and older who received Flublok, the most common injection site adverse reaction was pain. The most common solicited systemic adverse reactions were fatigue and headache. Other adverse reactions may occur. Please see the full prescribing information via the link below for more information.